Hi, my name is Casey Goldsberry. I'm going to be completing a physical assessment today. So what I'm going to do is introduce myself to my patient. Hi, my name is Casey Goldsberry. I'm going to be the nurse taking care of you today. We're going to be completing a head-to-toe assessment. Can you tell me your name?
Seth Goldsberry.
All right, Seth. And what brings you here to get this assessment done today?
I need a physical for my job.
Awesome, awesome. Before we get into this, do you need to use the bathroom?
No.
All right. I asked the patient if he needed to void his bladder or use the bathroom in any capacity, and he denied. So what we'll do is we'll move into assessing the patient's orientation and level of consciousness. So I'm going to ask him a few questions. What is your name and date of birth?
Seth Goldsberry, December 7th, 1998.
All right. What year is it?
2018.
All right. Who's the President of the United States?
Donald Trump.
And what would you do if you saw a house on fire?
Call fire department.
All right, patient is alert and oriented ×3. Patient's speech is clear. So the general appearance of the patient, adequate muscle tone, range of mobility, looks to be in good capacity. Patient looks well kept and groomed for his age. No obvious deficits noted at this time. So what I'm going to go ahead and do is move into inspection of the head. Normal cephalic. Patient's eyes are symmetrical, nose is symmetrical, mouth is symmetrical, eyebrows evenly distributed with hair, eyelashes evenly distributed with hair, hair on the head is evenly distributed, no areas of any balding or receding hairline. So what I'm going to go ahead and do is move into inspection of the patient's head. Tell me if there's any pain or tenderness whenever I'm doing this, okay? Any pain or tenderness in these areas?
No.
Okay. No masses or nodules or lesions noted at this time. So what we're going to move into is looking at the patient's eye. So what I want you to do is look up, look down. All right. Patient's sclera is white. Like I said earlier, eyelashes are even distributed. Conjunctiva is pink, and pupils are midline, no excessive dilation noted at this time. So what I want the patient to do is look at the wall for me, look straight ahead at the wall, and then look at my finger. All right. Patient has adequate accommodation and at this time. So what we'll do is we're going to move into the Snellen chart assessment. So I have a Snellen chart 20 feet away from the patient. I need you to cover your left eye, and I want you to read the lowest line possible that you can on there, please.
LEFODPOT.
All right, good deal. Patient's able to read 20/20. Cover the opposite eye and read the lowest line possible, please.
DEFBOTEO.
Okay. Patient read at a 20/25 level with the left eye and a 20/20 with the right. Now with both eyes, please read the lowest possible that you can on there, please.
LEFODPCT.
All right, 20/20 vision is bilateral eyes. So what we'll go ahead and do is move into assessing the pupillary responses of the patient. So go ahead and look straight forward, okay? I'm going to look at your pupils and I'm going to shine a light into your eyes, okay? Pupils equal, round, reactive, and reactive to light and accommodating. So what we'll do now is we're going to do the peripheral gazes, and what I'll have you do is look at this pin here and follow it with your eyes only. All right. Patient was able to follow in all 6 cardinal fields. Convergence was noted, and no strabismus was noted at this time. So I'm going to go ahead and look in the patient's eyes. So we will do right eye to right eye, left eye to left eye. All right. Upon examination, red reflex was noted bilaterally at this time. So for this part of the assessment, we're going to go ahead and check the sinuses. So we'll do the frontal and the maxillary front, and we'll check and see if there's any pain or tenderness. So let me know if you have any pain, okay? Any pain or tenderness in this area?
No.
Okay. Any pain or tenderness in the maxillary area?
No.
Okay. Patient denied any pain or tenderness in his sinuses at this time. So what we'll do now is move into inspection of both nares. What I want to go ahead and do first is I want to assess patency. So I'm going to occlude this nostril, breathe out. Okay, occlude this nostril and breathe out. All right, both nares bilaterally are patent at this time. I'm going to go ahead and inspect the nares. P, voice mucous membranes, no excessive drainage, anything along those lines. We'll move into the next nare. P, moist. No obstruction, no deviated septum noted. Alright, so what we'll go ahead and do is I'm going to assess the first cranial nerve, the olfactory cranial nerve. So I'm going to go ahead and have you close your eyes, cover one of your nostrils, and tell me what you can sniff here.
Cinnamon.
Alright, include the opposite nostril.
Not cinnamon.
Okay, what is it?
Close.
Patient was able to correctly identify both scents at this time. Olfactory cranial nerve is intact. And what we'll go ahead and do to finish the eyes is we're going to do the cover-uncover test. So cover your left eye. Alright, cover your right eye. Alright, no shifts noted. Patient was able to follow commands at this time. So what I need you to do is we're going to move into assessing the ears. So I'm going to palpate the external ear and your tragus. You let me know if there's any pain. The pinna, mastoid, and the tragus have been palpated. Any tenderness or pain in these areas?
No.
Okay, so we're going to check the ears with the otoscope, and what we're going to do is pull the ears up and back because the patient is an adult. So pulling the ear up and back with otoscope on. No excessive wax buildup. The tympanic membrane is grayish in color. And no excessive drainage noted at this time. The right ear is at 5 o'clock position. We're going to check the left ear. Up and back. Grayish light color. Mild drain and mild earwax buildup. And the left ear is at the 7 o'clock position and reflective to light. Okay. So what we're going to go ahead and move into is the mouth. And when we move into the mouth, we want to go ahead and I'm going to assess symmetry. Patient's mouth is symmetrical. Can you go ahead and say for me, please? Okay, I'm going to use this tongue depressor. Uvula is midline, mouth is pink, warm and dry, teeth are in alignment, no excessive gum swelling, no redness or bleeding noted. Go ahead and say again. I'm going to check your okay. Positive gag reflex noted at this time. Patient is able to say and open the mouth at an appropriate time. So I'm going to have you sit up real quick. So what I want you to do is cover your left ear, and I'm going to say something behind you to check your a whisper test, and I want you to respond with the same thing that I just said. Okay? So,
A.
All right. Cover the opposite ear.
21.
All right. Patient had a positive whisper test and was able to identify correctly both terms that were said to him. All right, go ahead and sit back. All right. So what we're going to do now is I'm going to assess your neck. Neck is symmetrical. There you go. Keep your chin up. Perfect. All right. No lesions or open areas noted. So what I want to go ahead and do is assess his carotid arteries. So I'm going to palpate and then I'm going to listen to them with my bell. +2 on the left carotid. +2 on the right side. I'm going to go ahead and listen with my bell to the left side. No bruit noted. No bruit noted on the right side. So I'm going to go ahead and have you sit up again. Perfect. Look up, keep your neck erect. All right. Tell me if there's any pain or tenderness. Any pain or tenderness?
No.
All right. No deviation noted of the trachea. What we're going to go ahead and do is assess the patient's ability to swallow at this time. All right. So if you can, take a sip for me. All right. Good deal. Any pain or difficulty with that?
No.
All right. Patient who has any pain or difficulty, thyroid and the trachea are both moved in alignment, and trachea is midline, no deviation noted. So patient is going to go ahead and I'm going to have you sit back for me. And we're going to go ahead and move into assessing the lymph nodes, and we'll start with the pre-auricular, the post-auricular, the occipital. The pre-auricular is in front of the ears, the post-auricular is behind the ears, the occipital is between the external occipital and the mastoid process. Tonsillary are at the angle of the mandible. The submandibular is between the tip of the mandible and the mandibular angle. The submental is behind the tip of the mandible. The superficial cervical is a superficial to the steiноmastoid muscle, steinocleidomastoid, and then the posterior cervical is along the edge of the trapezius muscle, and then the deep cervicular chain is underneath of the stenoid. Deep cervical chains is under the steinocleidomastoid muscle, over the larynx and thyroid and trachea, and the supraclavicular is deep in the angle that is between the clavicle and the steinocleidomastoid muscle. Okay. So upon that palpation, patient, was there any pain or tenderness?
No.
Patient denies any pain or tenderness, no masses or any lesions or anything like that noted. Go ahead and put your arms up above you. There you are. So what we're going to do now is the next set of lymph nodes, the central, which is high in the axillary area. Okay. Lateral is along the upper surface of the arm. The lateral is the border of the pectoralis muscle. The subscapulary is along the border of the scapula. All right, and the infraclavicular is behind the clavicle. So in this area. All right. Any pain or tenderness?
No.
All right. No masses or nodules were noticed at this time. So while the patient's uncovered, I'm going to go ahead and have you sit your arms out here. I'm going to assess the upper extremities. Skin pink, warm, and dry. Joints warm, no crepitus noted. I'm going to go ahead and assess your pulses. Bilateral brachialis is +2. Bilateral radial pulse is +2. Bilateral ulnar pulse is +2 as well. So at this time I'm going to go ahead and look at the patient's nail bed. The nail bed angle is at 160 degrees or less. no breaking the skin or any bleeding or any areas like that. So I'm going to assess the capillary refill at this time on all 10 digits. All right, capillary refill, it was immediate, positive perfusion noted. So what we'll do is we will go ahead and have the patient sit up for us. Perfect. All right, the AP diameter is 1 to 2. Take a deep breath for me, please. All right, positive chest excursion noted. What we'll do now is I'm looking at the skin. No obvious breaks in the skin, no excessive acne. Trapezius muscles seem to be in good standing, no drooping of the shoulders. Muscles are intact. What I need to do now is I'm going to listen to the patient's lung sounds in all 10 thoracic areas with the diaphragm of the stethoscope. So what I want you to do is take deep breaths in through your mouth and exhale through your mouth, okay? Deep breath. All right, any pain or tenderness with taking those deep breaths?
No.
Good, good, good. Patient's respiration's equal, unlabored, clear upon auscultation. I'm gonna go ahead and percuss the posterior back. Any pain or tenderness, let me know, okay? All areas are resonant, no dullness noted. I'm going to check the CVA at this time for any tenderness as well. Any pain or tenderness on either side?
No.
Patient denies any pain or tenderness in bilateral CVA at this time. So what we'll do is we'll move into the skin assessment of your anterior chest. So if you could sit up straight for me. Perfect. Chest is symmetrical, no excessive acne or body hair noted, no open areas or lesions at this time. So what we'll do now is I'm going to go ahead and I'm going to listen to your chest and listen to your lungs anteriorly. So deep breaths in through your mouth and out through your mouth again. Any pain with that?
No.
All right. Respirations were equal and unlabored and clear at this time. So what I'm going to go ahead and have you do is I'm going to have you lay onto your left side, looking for the point of maximal impulse. Go ahead and drape your arm over like that. Perfect. All right. Take some deep breaths. No pulsations, lift, heaves, or thrills noted at this time. So what we'll do now is I'm going to have you lay flat onto your back, and I'm going to listen to your heart sounds. So I'll listen to the 5 heart sounds, which is the aortic, pulmonic, Erb's point, mitral, tricuspid mitral, and then apical pulse for a full minute, and as well as counting respirations at that time. We'll use the diaphragm and the bell to auscultate these areas. So first with the diaphragm, we will listen to the aortic, which is second intercostal right of the sternal border. Pulmonic, second intercostal left at sternal border. Erb's point is third left intercostal of the sternal border. Tricuspid is fourth intercostal, left sternal border. Mitral is 5th intercostal, and it is mid-clavicular. And then we have the apical pulse, auscultated with the diaphragm, but we will listen with the bell for a complete minute at this time. Pulse rate at 88. No murmurs noted. So I'm going to assess the respiratory rate at this time as well. "18 respirations noted at this time." So what we'll do is we'll move into the abdominal portion of this assessment. So what I'm going to do is I'm going to put this back on you there. Good deal. I'm going to have you raise your knees for me. Perfect. There we are. All right. Patient is mildly rounded, no excessive body hair. Some mild amount of body hair noted to the lower umbilical region. No open areas, no bruising or anything along those lines noted at this time. So what we'll do is we'll auscultate the abdomen with the diaphragm of the stethoscope in all 4 quadrants. All 4 quadrants had active bowel sounds at this time. I'm going to go ahead and auscultate the aorta, the renal arteries, and the femoral arteries at this time with the bell of the stethoscope. No bruit noted at the aorta. No bruit noted at left renal artery. No bruit noted at the right renal artery. We'll move into the femoral arteries. No bruit noted at the left and right femoral artery at this time. We'll go ahead and palpate the femoral artery, and it is at 2+, 2+ at the left. So what we'll go ahead and move into is light and deep palpation of the abdomen. So let me know if there's any pain or tenderness with this light touch, okay? Any pain?
No.
Any pain?
No.
Any pain here?
No.
Any pain in this area at all?
No.
All right, we'll move into deep palpation. Any pain?
No.
Any pain?
No.
Any pain in this quadrant?
No.
Any pain in your lower abdomen?
No.
Okay. What we'll move into is we're going to check for rebound tenderness. So whenever I push in and let go, let me know if there's any pain whenever I let go, okay? Any pain whenever I let go?
No.
All right, now we're assessing the liver margins. Liver is not palpable at this time. Aortic pulsations are midline, and femoral pulses were audible at this time, and they were at a +2. So in the next part of the assessment, I want you to lay flat and keep your knees tucked right there, and then raise your head. Any pain or tenderness?
No.
No obvious herniation noted at this time. Lay flat. And we're going to percuss the abdomen as well. Any pain or tenderness in those areas?
No.
All right. All areas resident, no dullness noted at this time. So what I'll do now is we're going to move into your lower extremities, okay? So go ahead and lower your legs down. Perfect. Let them relax all the way. All right. So with the legs clearly in view, we have skin that is pink, warm, and dry. No open areas noted. The hair is evenly distributed. Joints are warm. No crepitus noted. I'm going to go ahead and assess all of the pulses. Popliteal pulse +2 noted bilaterally. Posterior tibialis is a +2 bilaterally, and the dorsal pietus is a +2 bilaterally. Patient's nail beds on bilateral feet are the 160-degree angle as well or less. No open areas noted on the feet. I'm going to check capillary refill on all of the tarsals. All right. Immediate cap refill was noted at this time. So what I want you to do is push your feet down like gas pedal. Pull your feet back up towards you. Perfect. Turn your ankles, twist your ankles. There we go. Positive range of motion in the ankles noted. Tuck your left knee. Put your left knee up. Okay. Relax. Do that with your right knee, please. All right. Relax. Patient is able to follow commands. Full range of motion in both knees bilaterally. Okay. Raise this leg. All right. Don't let me push you up. Okay. Don't let me push you down. 5 out of 5 strength in the left leg. Go ahead and lift this leg over here on the right. Don't let me push you up. Don't let me push you down. 5 out of 5 strength on the right leg as well. All right. Put back towards you. There we go. 5 out of 5 strength. Push down our gas pedal. 5 out of 5 strength noted. So what we're going to do is, since we've assessed the upper and lower body at this time, we're going to, and there was no edema noted anywhere on the patient's lower extremities. Bony prominences have no edema as well. We're going to move into the monofilament test for both the upper and lower extremities. We can knock that out. Okay, so I'll give you a frame of reference with these gauze. They're soft, sharp, and dull, okay? All right, go ahead and close your eyes and tell me what you feel.
Sharp. Soft. Dull. Soft.
All right, lower extremities or upper extremities monofilament test was positive, and the patient was able to correctly identify all objects. So we're going to move into the lower legs, and the same reference points are for the lower extremities, okay?
Sharp. Soft. Dull. Sharp.
Good deal. Patient was able to correctly identify all the monofilament. Now we're going to move into the monofilaments on the head. Same point of reference.
Dull. Soft. Sharp.
Good deal. Alrighty. We'll go ahead and cover you me back up here. Okay, so earlier we did assess the patient's olfactory first cranial nerve by having him do the sniff test, and he was able to correctly identify both of the scents. The second cranial nerve is the visual acuity fields, which we assessed with the optic cranial nerve with the pin whenever we checked all of his gazes. But to assess one more thing with the eyes, I want to do the peripheral vision test. So what I'm going to have you do is use this index card. I'm going to have you cover your right eye. Okay, and I'm going to cover my left eye, and then you're going to look straight at me. You're going to tell me whenever this is out of your peripheral vision, okay?
No.
All right. Cover the opposite eye. All right. You still see it?
Yeah. No.
All right. Patient's peripheral vision is intact and was able to corroborate with my peripheral vision as well for this test. To assess the third, fourth, and sixth, we went ahead and we did the gaze, we did the lateral gazes, and there was no nystagmus noted. We did the cover and uncover test, which there wasn't any strabismus or eye crossing noted at that time, and we did the cards for the peripheral vision as well. So for the fifth cranial nerve, we're going to assess the trigeminal joint, and what I'm going to have to do is the patient's going to clench his jaw by biting down, close your eyes. Any pain or tenderness in these areas?
No.
Okay. Clench your jaw. All right. Open your jaw. Close. No clicks or pops noted. Patient was able to note the sharp, dull, and soft sensations earlier with the monofilament test. For the seventh cranial nerve, we're going to test the patient's facial expression. So keep your eyes open. Smile at me. All right. Frown at me. All right. Raise your eyebrows. Puff out your cheeks. All exaggerated facial expressions were intact, and that would make the seventh cranial nerve, which is the facial, intact. All right. For the eighth cranial nerve, we're going to do auditory tests, which will consist of the Weber and the Ryan's test. So what we'll do is with the Weber's test, we're going to use the tuning fork, and we're going to place it midline on the skull in order to assess when the patient can feel the vibrations and whenever the vibrations cease, and the sound, because that will assess bilateral. So I'm going to have you close your eyes. All right. Oh, that was my bad.
No.
All right. Okay. So positive Weber test noted at this time. For the Ryan's test, we're going to start with the mastoid process and move down from the ear canal. And what we'll do is whenever the patient hears the sound at first, he'll say now, whenever it ceases, he'll let me know whenever that does stop there, okay? So we'll do that bilaterally, so we'll start with the right side.
Stop.
It's tuning fork.
Start.
Okay.
Stop.
Alright.
Start.
Okay.
Stop.
Alright. Positive Ryan's test was noted at this time. So since we have the tuning fork out, I'm going to go ahead and assess on the upper extremities at the joints, the elbow, and the wrist. So let me know when you feel the vibrations.
Start. Stop. Start. Stop. Start. Stop. Start. Stop.
All right. Patient was able to correctly identify whenever the patient felt the vibration when the vibration ceased on the upper extremities. So for the glossopharyngeal and vagus nerve, earlier we did the assessment of the mouth, in which we did the patient saying ah, and the patient's ability to swallow with the trachea when it was assessed, and then we did the gag reflex as well. So for the 11th cranial nerve, which is the spinal accessory, I want you to go ahead and sit up for me, okay? All right. Sit up straight. Perfect. Shrug your shoulders up. All right. 5 out of 5 strength. Trapezius muscles, like was stated earlier, that they are in good standing, adequate muscle tone for his age. Patient's able to shrug his shoulders against resistance, which tests the 11th cranial nerve. And while I have the patient sitting up, I want you to turn your head towards me. All right. 5 out of 5. Turn that way. 5 out of 5. Tuck your chin. Put your head back. Okay. Now touch your left ear to your shoulder. Now do your right ear to your shoulder. Positive range of motion noted in the neck. Now at your waist, I would like you to turn to your left side. All right. Turn to your right side at your waist. All right. And I'd like you to bend down and touch your toes. All right. Spine is midline. No obvious scoliosis, but we will further assess that when the patient's standing. Positive range of motion in the spine. So go ahead and sit up for me. Thank you, sir. All right. Now I'd like you to stick your tongue out at me, please. Okay. And push it to the left side, to the right side, up, down. Okay. Hypoglossal 12th cranial nerve is intact at this time. So for the musculoskeletal assessment that we have semi-hit most of the areas, but we'll go ahead and get the upper body done, and then we'll move into the lower body. So what I'd like you to do is put your arms straight out in front of you. Okay. Move your wrist up and down. Okay. Rotate your wrists. Good deal. All right. Go ahead and bend at your elbow. Bend at your elbow. All right. Bend up. Don't let me push you down. Okay. Don't let me push you back. All right. 5 out of strength in the right elbow. 5 out of 5 strength in the right elbow. Okay. Don't let me push you back. Okay. Don't let me push you down. Okay. 5 out of 5 strength in the left elbow as well. So what I'd like you to do while you have your arms up, bring them out to your side. Okay. Put them behind you. Okay. Put them back out to your side. Raise them up above your head. Any pain or tenderness whenever you were doing those motions?
No.
Good deal. Good deal. All right. So what I would like you to do is go ahead and sit back, and then what we'll do is we're going to move into the lower body. So earlier we did assess the ankles and the knees for their range of motion, and what we'll do now is what I want you to do is take this leg out to your left. Okay, bring it back in. Take this leg out to your right. All right, positive abduction noted. Lift this leg. There you go, that's perfect. Bring this leg in. Okay, bring that back out. Put that leg down. Bring your right leg up. Bring the other leg in. All right, positive abduction noted at the hips. So what we're going to do before we move on to the stereogenesis test and all the other sensory tests, go ahead and lift your hands up real quick. Put your fingers straight out. There you go. Don't let me squeeze them together. All right. 5 out of 5 strength noted in the fingers. We assessed the wrists, and they were in positive range of motion at this time. So go ahead, and I'm going to have you sit up, and we're going to move over to the side of the bed. Alright, so for the lower extremities, since we've already tested all the strengths and graded them and did range of motion of the feet, ankles, knees, and hip joints, we're going to go ahead and move into the patient's gait. So if I can have you stand up, please. Okay, walk heel to toe towards that wall. Back. Okay. Turn and face that way. And I'd like you to dangle your arms down in front of you and touch your toes. Spine is midline, no signs of scoliosis. Patient is able to bend over and follow commands and touch toes without any problem at this time. So stand straight this way. What I would like you to do is jump up and down, please. Good deal. Patient's able to follow commands, maintains balance. Take your right heel and touch your left shin and rub it down. Perfect. Now do that with the other one. That's perfect. Go ahead and close your eyes. All right. Positive Romberg test. Patient did not have any sway or any signs of losing balance at this time. So what we'll do is you can keep your eyes open, stand on your left foot and raise your right. Good deal. Relax. Do that with the opposite foot. All right. Good deal. Relax. All right. Patient's ability to maintain balance is adequate and no signs of sway or any deficits at this time. So what I would like you to do is sit down for me. Okay. So put your hands out in front of you and close your eyes, touch your fingers to your thumb rapidly. There you go. Patient is able to follow commands, is able to complete tasks. And what we need to do now is go ahead and relax. I'm going to have you take your finger and touch your nose with your right hand. Perfect. And put your finger out in front of you. Now come back and touch your nose again. Perfect. Relax that arm. Do that with the opposite arm. All right. And out and in. Perfect. Patient is able to follow commands without any deficits at this time. So for the stereogenesis test, we're going to have the patient identify some objects that I place into his hands. So keep your eyes closed and just identify the objects as I put them into your hands.
Paperclip. Key.
Okay.
Gauze.
Good. Patient was able to correctly identify all of the objects placed in his hands on the stereogenosis test. Now I'm going to do the graphesthesia test. So what I'll have you do is keep your eyes closed, relax your hands out. I'm going to draw a letter and a number into either of the hands, and you tell me what I draw, okay?
A. 7.
All right, patient was able to correctly identify the objects that were drawn into his hands at this time. So what we'll do now is we're going to have you relax your arms, and we're going to assess all of your deep tendon reflexes, okay? So go ahead and keep your eyes open. That's okay. We're going to do the right arm first. So I'm going to put my finger over the brachialis, and we're going to assess the bicep. Okay, tricep. Okay, positive tricep, brachioradialis. Okay, keep your hand relaxed, and then we're going to assess the wrist. Okay, all were 3 out of, rated them at 3 on a 1 to 4 scale. So we will do the bicep on this arm. Tricep. Okay. Brachioradialis. Okay. Relax his hand. Feel the wrist. Okay. 3 out of 1 to 4 scale. 3 was noted bilaterally on both arms. So for the lower extremity, sit back a little bit more. Let the areas relax. We're going to do the patellar. Okay, positive 4 out of 4. Okay, 4 out of 4 was noted. Now we're going to do the Achilles. Okay. Alright, good deal. Patient had positive DTRs in all aspects, upper and lower. Patient was able to follow all commands. I'm going to go do one last test. I'm going to test the Babinski's. Patient elicits a negative Babinski's at this time, adequate for patient's age. So thank you so much. Physical looks good, and good luck to you, and this completes the physical assessment.